Hi, Leah, let's get started. Good afternoon, everyone. Welcome to the Cardiac Emergency Planning webinar for rural Colorado schools. I'm Casey Warner, Director of Community Impact for the American Heart Association of Colorado. The interest in this webinar has been incredible, and we know, along with our collaborators at Global Medical Response and Children's Hospital Colorado, we are very excited to help your school become better prepared for a cardiac emergency. The American Heart Association is also excited that we can provide equipment to train a generation of lifesavers in CPR and add usage through our CPR in Schools initiative. We know that the average response time for emergencies in rural areas is 40 minutes, with nearly 1 in 10 victims waiting almost half an hour for care. In a cardiac emergency, every second counts. And so we appreciate you taking the time out of your busy schedules today to learn more about writing and implementing a cardiac emergency response plan. Today, many American Heart Association resources will be shared, but I would also like to let you know that I am a local resource and I'm happy to share expertise beyond cardiac emergencies. We know that during the pandemic, schools have been faced with extraordinary challenges for both their students and their staff. So we have ramped up our resources to support nutrition programs within schools to combat food insecurity and provide guidance on tobacco and vaping issues as students are turning to these substances even more to cope with mental health challenges. If you have any questions, please drop them in the chat and we will address them throughout the presentation or at the end of the question and answer period. So it is now my pleasure to introduce Dr. Chris Rausch, our first speaker. Dr. Rausch is a pediatric cardiologist at Children's Hospital Colorado and serves as the medical director for the Pediatric Cardiology Network of Care. So Dr. Rausch, you may now begin your presentation.
Okay, thanks everybody. Hopefully you can see and hear me okay. So I'm really excited to see so many people having interest in this today. We have been fortunate at Children's Hospital to see patients who have benefited from these kind of programs in schools. We've been able to, I've personally taken care of patients who have survived because of training, CPR training, and emergency response planning in schools who almost certainly would not have survived if this sort of thing wasn't in place. Thankfully, sudden cardiac death is relatively rare in young people. Maybe 1,500 to 2,000 people each year under the age of 24 die from sudden cardiac arrest. But as we sort of pointed out in the earlier quiz, a lot of those people who have sudden cardiac arrest don't survive to hospital discharge. Historically, it's been about 10% of people who have a sudden cardiac arrest outside of a hospital in the community survive to being discharged from the hospital. And we know that that can be much better when you have access to automated defibrillators, AEDs, and if you have an action plan that's practiced and in place. And there have been several research studies that have shown that schools that implement emergency action plans and have AEDs accessible can have hospital discharge survival rates of well over 65%. So having these tools available, like an AED, and having a plan and practicing that plan can make a huge difference to the survival of both children and adults who are in the schools who suffer one of these events. Our hope at Children's Hospital is that every school in the state would have an AED and perhaps more than one AED, depending on the school campus and the location of practices and that sort of thing, so that an AED is accessible within just a few minutes in the event of sudden cardiac arrest, and that every school in the state would have an action plan that they have practiced and that they are prepared to put into place when something terrible like this happens. hopefully we can make a difference. And I'm really excited that you're all here to be a part of that difference. And I'm very thankful to the American Heart Association and to Project Adam for supporting education in schools and for hopefully helping us reduce the number and maybe even eliminate the number of deaths related to sudden cardiac arrest. Thank you.
Well, thank you, Dr. Rausch. And if anybody has questions for Dr. Rausch, you can go ahead and put them in the chat and we'll get to those. So next up is Courtney White. Courtney is the Project Adam Colorado coordinator at Children's Hospital Colorado, and we're happy to have Courtney join us today. And Courtney, I'll turn it over to you.
Thank you so much, Casey. I truly appreciate it. It is wonderful to see so many participants on this webinar. And so we will go ahead and get started. So, is your school prepared for a cardiac emergency? And so we will definitely go through some objectives that we will try and cover in this webinar. What is sudden cardiac arrest? So we will definitely dive a little bit deeper into that. And why are we targeting schools? There is a reason as to, why we are targeting this specific population. We will go into Project Adam's mission and what they stand for. And we will also discuss what it is to be a heart-safe school. And then finally, we will just go over some available resources that we have available for you when you are establishing your defibrillation program within your school district or your school. So what is sudden cardiac arrest? In the quiz, we did mention that sudden cardiac arrest and a heart attack are different, and they are. And so a sudden cardiac arrest is defined as an electrical malfunction within the heart. And so what happens is the heart stops beating unexpectedly. This essentially then allows the victim to fall and suddenly become unresponsive. So it is a very sudden thing. The victim may also have some abnormal breathing. They may also not have any breathing, but usually it's like this gasping sort of breathing that you may see. And they may also have some seizure-like activity once they have collapsed. And so body may be twitching some. So these are definitely some things to look for if you have a student or an adult within your school who suddenly falls and collapses. Then, of course, we want to initiate the emergency response plan. So we want to call 911, we want to start CPR, and we want to obtain the nearest AED that is available. So the most important thing for a sudden cardiac arrest is to recognize the signs and symptoms, because as we mentioned earlier, every second counts when it comes to someone who is in cardiac arrest. So what is the cardiac chain of survival? What are we doing if we see a patient or see a victim who has collapsed suddenly? Again, we want to call 911. We want to get EMS to our location as quickly as possible. So we want to notify them first. Then we want to deliver our high quality CPR. Again, we want to obtain the AED. We want to apply it to the victim, and we want to essentially follow the prompts that are going to be given to the team by the AED. Advanced resuscitation, right? So this is essentially EMS has arrived. EMS will then transport the victim to the hospital. Post cardiac arrest care that is in the hospital, the various testing that's being done to essentially try and decide what caused this. Is there a cause? Did it just happen? Those sorts of things. And then ideally recovery, getting that patient out of the hospital with, minimal neurological consequences and getting them on to their daily lives. So what is an AED? This you have probably seen in various locations. Hopefully your school has one, but it is a portable electronic device that is applied to a patient's torso. And essentially this diagnoses life-threatening rhythms and can deliver a shock to essentially reset the electrical activity of the heart and establish a normal rhythm. You will see at this last point and this, the diagram, that every minute that there is a delay in defibrillation, your chance of survival actually decreases by 10%. And so having access to these AEDs and applying them to the victim as soon as possible is extremely important. So why target schools? What's the point? And so on any given day, it has been shown that there is approximately 20% of a community within the school walls. And in Colorado, there are 178 school districts, and 146 of those 178 actually meet the definition of rural or small rural. In rural settings, the average EMS response time has been shown to be about 14 minutes, with nearly 10% of those waiting almost a half hour for the arrival of EMS. And so if we're waiting until EMS arrives to apply an AED, that patient or victim may already have lost their chance to, having survival after hospital. A couple of articles that I will explain a little bit is this one was released in 2017. And what it looked at was essentially state level health and safety policies across the country and DC, and what the implementation of these policies were to help prevent sudden death, as well as catastrophic injuries, including, concussions and heat strokes, and those sorts of things. And so they established this rubric that looked at the various policies in place and provided rankings for all 50 states, again, plus the District of Columbia. And so where did Colorado land in these rankings? Dead last. We were 51 of 51. So as you can imagine, we have quite a ways to go in improving our health and safety policies when it comes to these catastrophic injuries, especially in the school setting. So then if we're looking at these policies, great place to start is legislation. What laws are there even in Colorado? And currently there are only two in addition to the Good Samaritan law, but the two that exist are AED placement in schools. So just encouraging districts to acquire AEDs and maintain these AEDs on public school grounds, and then school staff training. And so this essentially says that any coach of an athletic program, they must be currently certified in CPR and AED use. Currently, there are no state laws pertaining to school cardiac emergency response plans or drills or anything like that. So currently, these are the only two state laws that exist when it comes to CPR and AEDs. So another policy statement was recently released during COVID. And so this was released by the American Academy of Pediatrics. And again, it dived into the sudden death in the young, and essentially how does the primary care provider even fall into this realm of work? And they discuss various topics throughout this policy statement. However, the one that I want to draw your attention to is establishing the primary care physician's role in secondary prevention. So number 3. And what it said was essentially, they needed to establish a cardiac emergency response plan, because within that plan, if that is created, it helps facilitate a more structured response to a sudden cardiac arrest. And so the various elements that people may not think of when establishing a cardiac emergency response plan involves a multitude of things. And so one, establishing an effective communication system. If someone is having a cardiac arrest out on, the soccer field that is quite a ways away from the building, how are we alerting the rest of the staff to essentially come and help? Ensuring that there are a number of trained responders in both CPR and AED use to respond to an emergency. Having access to that AED, again, is important. Acquisition of necessary emergency equipment. Having communication with your local EMS system. And so knowing that EMS is aware of your response plan as well as your program has been extremely helpful in multiple school districts. And many of them will actually help run some cardiac drills within your school, because they love to see that a school is prepared. And, hopefully by the time EMS gets there, the victim is alert and responsive, and the EMS job is a little bit easier. So including them in your plan is very important. And then practicing this plan, putting that plan into place. You are essentially required to do fire drills. So maybe we should require cardiac emergency response drills. And so that is definitely being written into some legislation across the country to put these plans into action. So some things to think about when writing your emergency response plan is, in an ideal world, your plan should target a collapse to an EMS call time of less than 1 minute. Again, because time is of the essence, this whole plan is every minute counts. And so you want to provide the CPR, and you want to ideally get a collapse to a first shock from an AED of less than 3 minutes. And so again, just making sure that an AED is accessible, can easily be retrieved from most, if not all, areas of your school, and brought to the victim in less than 3 minutes. How many of your staff should be trained? Ideally 100%, but we know that's not always feasible. So we say at least 10%. And this was also the AAP recommendation, to ensure that enough staff are trained and can respond to an emergency, to also cover vacations or leaves or, things, people that may not be at that particular school every day, i.e. like the district nurse or something of that sort. So 10% is kind of a nice cutoff in that regard. And the AAP actually recommends 2 successful emergency drills be conducted every year. So just to keep that in mind. So where does Project Adam come in? What is Project Adam? That's probably a big question. And so Project Adam began in '99 after the death of a young teenager, Adam Lemmel. He was playing basketball. He was an avid athlete. And he was in a game. He suddenly collapsed, and at the location of this game, an AED was not available. So unfortunately, Adam did pass away. And since this project started, since its inception in '99, there have been over 200 lives that have been saved across the country because of this project. Currently, as of April, there are 35 established programs across the country, 6 states, and there are some still in progress. Ideally, we would love to get the entire country covered. But, we have made great progress. And to become an affiliate site of Project Adam, you do have to be affiliated with a hospital of some sort, have a medical director, as well as a coordinator. And then that, allows you to become an established site. And so in collaboration with Children's, Project Adam Colorado, we really are committed to helping schools not only implement, but also sustain a public access defibrillation program. We don't want it to be more burdensome than it needs to be. And we really want to create awareness and have the staff and students and teachers within the schools really recognize how a sudden cardiac arrest can present. We want to provide the staff with the necessary resources. Again, we don't want it to be a burden to, be able to get the training in CPR and be able to have a response plan in place. And so we really want to be here almost as a consultant to really help in planning, where should the AED go if we only have one available? What is the most, reasonable place to put it in terms of traffic and people who will be using the gym, outside of school hours and those sorts of things, and just really helping think of all of the necessary elements that, that should be thought about when putting a plan in place. When it comes to preparedness within schools, we really want to ensure that there is training available for all staff, teachers, coaches, students. We would love to see, students be trained in CPR prior to high school graduation. We want to ensure that the CERPs, the cardiac emergency response plans, are there and all staff, can respond in the event of an emergency. And what does that look like? Is that through the use of walkie-talkies? Is that through the use of cell phones? Just thinking about all of those logistics, ensuring that the AEDs are available. Again, providing the ability to run drills so that staff become more familiar with how the response plan will work in the event of a true emergency. And then really identifying those students who may be at a higher risk of suffering a cardiac arrest because of a diagnosis. And so ensuring that we are all familiar with these students, and ensuring that the staff who may be with these students for extended periods of time know how a cardiac arrest can present. And so Project Adam is really here to assist all schools, districts, various communities as well, and just establishing this plan, putting it into place. We know that cardiac emergencies don't happen every day, but when they do, and it doesn't go well, we've seen the repercussions from that. So we really want to ensure that schools are equipped and have a quality program that not only includes, I have an AED and I'm done, but really includes awareness, the training, and the policy that may need to be in place to ensure that if a victim does suffer a cardiac arrest, they have the best chance of survival. So Joe Lemmel once said, who was the father of Adam Lemmel, Adam is still making a difference. There was a door that was opened and I had to make a choice. The choice was obvious. I can't help my son, but I can help yours. And so he has really devoted his life to Project Adam since, Adam's death, and is an integral part of the national program. And so how do I get started? There are many ways to get started, but the best way to kind of see where your school is currently when it comes to having all of these various elements in place is the Project Adam website. There's a Heart Safe School checklist. And really what this does is divides the Heart Safe School into 5 different areas. That includes the equipment itself, so AEDs, having a response team, as well as a cardiac emergency response plan, the CPR and AED training, and then drills. So all of this can be found on the Project Adam website. It is all a free resource, so you don't need to recreate the wheel. It is already there for you. And outside of just this one checklist, there are various manuals and toolkits, videos, training templates, all sorts of things that you can look and see if it would be beneficial to your school or school district. Some other organizations that also have resources available to you. Again, American Heart Association, Parent Heart Watch, and Citizen CPR Foundation are great organizations that focus more on the community aspect. You have the SADS Foundation, as well as the American Red Cross. So these are all organizations that you can sort of take a look through their website and see if they may have resources that could be helpful for you. Then finally, I just want to finish with a video. This is a video from Atlanta and one of the saves from Project Adam, but you will see here how important it is to have a coordinated response.
But the 100th save was a girl named Claire Crawford. She was playing volleyball. And it's, you know, CPR stories and saves are really interesting to me because it seems that a lot of things have to go right. But it's not really luck, it's more preparedness. And as long as you're prepared to respond in case of an emergency, because it can happen anywhere at any time. And so that's why it's called a sudden cardiac arrest. Well, she was playing volleyball. She went, and it shows her dad had set up a video. It was senior night. She's the only senior on the team. And they were playing a team that they thought they would play again in the playoffs, so they were going to use it for a scouting video as well. He'd set up the tripod, pushed the play button on the camera, and it captured the entire collapse of sudden cardiac arrest and her rescue.
So as you can, sorry. So Claire has obviously given given Project Adam to use that video as much as possible, but it is extremely powerful. And it goes to show you that even in an urban area like Atlanta, EMS may be responding to a different call, and without an AED, if they would have been waiting 11 minutes, her chance of survival would have been less than 10%. And so knowing that this school was prepared and did everything correctly, she was awake and alert before EMS even arrived.
Well, thank you, Courtney, for sharing all of that very important information. And if you have any questions for Courtney, you can go ahead and put them in the chat and we will follow up. So now we will hear from Dr. Sarah Perman, who is Associate Professor, Emergency Medicine at the Colorado School of Medicine, University of Colorado Anschutz Medical Campus. Dr. Perman will discuss hands-only CPR. So Dr. Perman, thank you for joining us, and you may begin.
Wonderful. Thanks very much, Casey. And Courtney, thanks for that really compelling presentation. I think you really hit it out of the park with that last slide so that we can really see how impactful these plans are at schools around the country. I am going to talk today about hands-only CPR, which is something that is very near and dear to me as an emergency medicine physician, but also a member of the community, because I think that this is something that's really important for all of us to have some appreciation for and have as a skill that we can provide in an emergency. If you would mind going to the next slide. So what is the problem? So we know that only about half of individuals who suffer an out-of-hospital cardiac arrest receive immediate bystander CPR. And, you know, to be perfectly honest, that number is actually, that's a little generous. Here in Colorado, our bystander CPR rate is about 41.7%. And I'll say if we look across the country, even if we look across counties, those statistics actually vary, and they vary pretty considerably. We can see rates as low as 20%. We can see rates sometimes a little bit higher. But what we do know is that we know that without CPR within those first 10 minutes, survival is very low. And survival, especially with intact neurologic recovery or with good brain activity, is even lower. So next slide. So we know that CPR can double or even triple a person's chance of survival after cardiac arrest. And so that's why CPR is so important, because it's something that we all can do. And in doing that, we can actually impart better outcomes for individuals who suffer these sorts of events in the community. Next slide. So as we saw in the initial quiz, and I was happy to see a lot of people got this question correct, what are the 2 steps that we can all do to save a life? And the first is really very important, and it's calling 911. I know there was a little confusion over which goes first. Do you start CPR and call 911? Do you call 911 and start CPR? And it's really important to make sure that you initiate emergency response, because in the end, you're going to need help, and you're going to need support, and you're going to need extra hands. And so that initial call to 911 is very important. And the next is to just push hard and push fast. We have a lot of opportunities here with something that can even be coached through telecommunicator assisted CPR. So when you call 911, sometimes on the other end, the operator can talk you through CPR, or in a scenario like what we're hoping for here today, where there's a lot of really profound and strong education to students and teachers and coaches and administrators and all the people who are in schools. We can provide CPR with that training that we've all acquired. So next slide. When do I use CPR? So I think this is actually really important. It's important not just in the community, it's important kind of across the full spectrum of where we encounter situations where people are in a medical emergency. And the common misconception is a heart attack is the same as a cardiac arrest. A heart attack is as it says here on the slide, a circulation problem. It's essentially when the heart's not getting enough oxygen or nutrient. And it often will look like an awake person. The classic picture is they're kind of clutching their chest. They're having discomfort. They're feeling short of breath. But to put it very simply, they're awake. When we see cardiac arrest, which is described here as an electrical problem, I would actually kind of expand upon that and say that cardiac arrest is not only an electrical problem, but it can also be a pump problem. You essentially have no pulse. So individuals who are in cardiac arrest, they're not awake. They're not talking to us. They're not describing chest discomfort. They're not describing shortness of breath. They are in a true medical emergency where they are unresponsive and they don't have a pulse, whether it be because their pump is failing them or the electricity that operates their pump is failing them. And so these are really important designations, not just in terms of our understanding of the process, but also understanding of what we should do to intervene. And clearly here, when we talk today and we talk about CPR, we are talking about cardiac arrest in its pure sense of true pump failure. So next slide. So this, I think, is an issue that comes up frequently with respect to fears about providing cardiopulmonary resuscitation or CPR chest compressions. There's a lot of fear that you might hurt somebody. There's fear that I might, provide an intervention that maybe you don't need, and I just don't know that you don't need it. But the reality is that the layperson initiated CPR for presumed cardiac arrest actually is fairly low risk. And I'll put this bluntly, if somebody is in such an extreme of medical condition as having no pulse, you can't hurt them any more than they've already been injured. They're not able to create a pulse, to perfuse, or to bring blood to their brain, to their lungs, to all of their organs. And so you really are in a situation where you can't hurt someone more than they already are because they have suffered this catastrophic event. And the Good Samaritan law is essentially intended to protect people from this fear of causing harm. And just to say, it's for a person who in good faith administers emergency care at the scene of an emergency or in a hospital is not liable in civil damage for an act protected during the emergency unless the act is willfully or wantonly negligent. And so I think many of us kind of think about this as being a little bit of a protection, but it's based upon the fact that CPR saves lives, and we know it's the right thing to do, and it is protected with a law. Next slide. So what are the steps that lead up to performing CPR? This is actually really important because one of the mantras in providing CPR is you always want to make sure that your rescuer is safe. If you're in a scenario, and we talked a lot about this with COVID, if you're in a scenario that's perceived as unsafe, you want to keep yourself as the rescuer safe first, because you're really not very effective or helpful to another individual if you yourself do not feel safe. So make sure the scene is safe. If that means clearing people away, if that means asking loved ones or family members to step aside, if that means moving somebody from a location that is deemed unsafe to a more safe location, those are important things to do, not just for your safety as the rescuer, but also for the individual who's downed to be safe as well. Tap and shout. So this is kind of that initial, are you okay? Are you okay? There are scenarios, and especially, in athletics or at schools or even in the community, at the gym, at the grocery store, people can have episodes where they faint or pass out. And so it's very important to say, are you okay? If you don't get a response, the right thing is to take these next two steps. The next step is to designate someone to call 911 and to get an AED if one's available at any of these public locations. And then to assume your position and start chest compressions. Next slide. So what are chest compressions? Chest compressions are, I think many of us have probably seen this in practice. We've seen this on television. We've seen this at our local, BLS or ACLS courses provided by the American Heart Association or other agencies. And chest compressions are essentially meant to push on the chest to kind of mimic a full heartbeat so that you can circulate blood, oxygen, and nutrients around the body. And it's meant to mimic that normal compression, that normal squeeze that the heart would provide if it was functioning right. Hands-only CPR essentially takes away the question about breaths. We don't do rescue breaths anymore in community downed parties. There are some nuances to certain approaches to resuscitation, but it's really important. And data has shown that just doing simple chest compressions are good enough and actually do impart benefit while you're waiting for an EMS agency to arrive. You want to push hard, you want to push fast in the center of the chest. And we often talk about being right between the nipple line, right over the sternum, and making sure that you're using the palm of your hand to push on the individual's chest. You want to allow the chest to actually fully come back to its normal depth. So when I say that, we call that recoil, which is that if you push down, you want to allow the chest wall to recoil and raise again. So you want to push down and then release. It's important that you push to at least 2 inches of depth. And that again is just to mimic a similar kind of contraction as to if the heart was beating naturally. And you want to compress to about 100 to 120 compressions per minute. We've all heard "Staying Alive" as a good song to kind of sing in your head. But I'll be honest, when I've taught CPR in schools, I date myself by saying "Staying Alive." And so if you Google, there are a lot of songs that are a little bit more current that have a beat of about 100 to 120 compressions per minute that I'm sure the students will recognize much quicker than "Staying Alive." I will say to a much younger crowd, "Row, row, row your boat" is actually 100 compressions per minute as well. And so that's one that the really young guys can apply. Next slide. So, I think it's important for us to talk about an AED as well. We've just seen in the chat the number of AEDs or automatic external defibrillators that are located through the schools that are participating in this webinar. And it's really important for us to recognize these because these are very important, especially with a lot of pediatric or cardiac arrest in children, and similarly with adults. So an AED, it's a lightweight portable device that delivers an electric shock through the chest wall that will then hopefully restart the heart so that that electrical kind of dysregulation will actually be righted. It is really important, a handful of really important teaching points on AED usage. It is very important to turn the device on. It will give you all the directions that you need. You don't need to worry about being familiar. It will tell you what to do. You want to peel away the backing, a paper backing on the pads and make sure that the pads adhere to a person's bare chest. This is really important as well. A lot of times, as in this picture, we see depictions of men or boys or, younger individuals who are having a cardiac arrest, but with women as well. It's very important to remove clothing, remove any undergarments, and make sure that those pads adhere to the skin in order to have good contact so that the shock can be effective. And the device will tell you what to do. It will tell you as it's analyzing the rhythm, if it's an appropriate rhythm to shock, and it will tell you when to shock. And it's really important on our side that after you deliver that shock, you resume CPR right away. Next slide.
The next slide is me, Dr.
Me.
That's
Thanks
great.
very much.
That's great. And if you have any questions for Dr. Perman, you can put those in the chat as well. Not sure if I have video or not, but that's okay. My name is Jim Myers, and I've experienced both pumping and plumbing problems. I was actually 38 when I had a heart attack, and pretty young at that point. No pain or pressure. No, it was a complete surprise. I think a lot due to stress. I was in pretty good shape that way. So, and then more recently, I've had an AED installed. So I've got an inboard AED called an ICD that I use on well, hopefully not use, but it's there in case I need it because I was in VTAC. My heart was going too fast. So it was going 200 plus beats a minute. And I didn't pass out, but I knew enough to call 911. And the paramedics took me to the heart hospital here. So just want to let you know, I am the CPR manager for the Southwest region, which means Colorado is part of it, Wyoming, New Mexico, Texas, Oklahoma, and Arkansas. And so my job is to get CPR kits into your hand. And with the help of my esteemed colleague, Elizabeth Tork, we'll follow up this presentation with an email to give you all those resources and to frankly ask if the address that you put on your registration matches where we need to send the kits that way too. And by the way, thank you for joining us on this. I know there was a little incentive to get some CPR kits. These are substantial kits, by the way. They are 30+ pound duffels. It doesn't look like much there, but it really is a pretty big duffel. And you're actually getting two. You're getting a CPR anytime a kit, like as shown here with all the things in it, but you're also getting a youth sports kit, which is a same size, great for coaches, great for your PE staff that way too, because it talks about things like concussion in first aid and bone breaks, those types of things. So it's a little more substantial in terms of that. Next slide, please. Nation of Heart Savers. That's our designation with the American Heart Association of schools that are designated of having their CERP or CERP in place. Really important to have that CERP in place. It's almost like having a car without an engine. You know, you can have the AEDs and you can have everybody trained, students and staff alike. But if you don't have a plan when it actually unfolds, it really is like a car without an engine. You can't really go anywhere. It's not functional. So having a CERP in your school or district really helps bring it down. And I noticed in the chat, some of you maybe didn't have a CERP or you're working on it. And again, as I mentioned in the chat, we're happy to help you with that. So please reach out to us and we can give you some resources on that as well. So you become a nation of heart savers. It's a national movement around safety and emergency preparedness in our community. And like one of our panelists said, it also works with your local EMS folks. So it's not just your school, it's the community that's involved, which I think is really important. Next, we're going to have a video that I think will be enlightening as far as what happened in an actual school situation, elementary school, but an actual school situation. Thanks, Elizabeth.
Okay, class, today we're going to learn the steps for hands-only CPR.
If you had told me before I started this class that one of my students would save his mother's life through hands-only CPR, I would have said, no way.
Eeny, meeny, miny.
What he did was save my wife's life. It was a scene that I will never forget.
I came in, my mother was on the floor, completely passed out.
She was not breathing.
Everybody else was crying in shock.
My panic caused me to freeze.
But I knew to do CPR. So I got on my knees and started the compressions.
He took charge. The compressions that he was doing was amazing. He didn't stop until she moved. Her breath just opened up full of air.
She was starting to breathe. It was amazing. I couldn't believe it.
I was so relieved. Like, oh my gosh, she's here. She's not gone.
My 9-year-old son, Dimitri, saved my life. He will always, forever in my life, be my hero.
I want to thank the American Heart Association for offering these classes at schools to make sure everybody's aware how to perform CPR.
The American Heart Association trains 17.8 million people each year in hands-only CPR, and yet there's still so much work to do.
Because of this class, I still have a mom.
I gave him life, but yet in turn, my 9-year-old gave me back my life.
I gave him life, and yet in turn, my son gave me back my life. What a powerful statement. And we have lots of those stories, folks, all around the country and around the world, because the benefits of CPR don't just stop in the classroom. They really go well beyond your walls into your communities that you also serve. So the more people you have trained on hands-only CPR, the more you can respond to those situations. And even teachers and staffs. We've had teachers and staff folks saved by students in schools too. So it's a really great challenge Dimitri is having here. So commit to creating your CPR. And those of you who are already doing it, great, congratulations. That's a great start. The hardest part of the 10,000-mile journey is that first step, but you've taken that step, so you're on your way. And include the training for your students annually. We have a school system in Dallas that actually does 5th, 8th, and 10th grade just to make sure it sticks with the kids, because they're all, as you well know better than I do, learning at different levels along the way. So that's Dimitri's challenge to all of us. The next slide really talks about global medical response, and they're the ones that really are offering these kits for you for free. It's an incredible thing. And if you know anything about them, they're a national and international response group of first responders with ambulances and fire departments involved, helicopters, fixed wings, aircraft, more than 35,000 clinicians and support personnel with them. So it's an incredible organization, and they've generously done this in Colorado. And you all are the only ones that have had it in the entire nation this way. So it's an incredible gift, this. And then AHA is upping the ante by offering that youth sports kit as well. So your athletic folks can really benefit from that too separately, which is really, really cool. All right, next, here's a slide that really talks about, our contact information. There I am at on the left, Courtney there with Project Adam, Colorado. And Colorado Children's is also in there, and tobacco-free schools. We didn't talk much about that because this was really CERP planning that way, but Casey Warner, who started this whole program, is the one to contact concerning any of those other school issues that we can help affect with the American Heart Association. So if you have any questions, now is the time to ask those. If I haven't heard from you, maybe we can unmute somehow if you want to try to do it that way. If we can't, just throw something in the chat. We
have one question
okay.
Asked by Jody. What is the youngest age you'd teach CPR to?
That's a great question. And I'm BLS trained as an instructor too. And I would say 3rd grade is about it, because you still need to, when you're doing compressions, you still have to press down 2 inches and allow the chest to recoil back up. So it takes a lot of strength. It really does. So 3rd graders that are tough 3rd graders are probably have enough weight, for the most part, to be able to kind of handle that. Great question.
Sarah asked, how do we get our free kits?
Well, you said, no, it's going to be very easy. We're going to send out an email to you. Elizabeth Tork, my colleague, is going to send out an email to you that will have all the resources kind of we talked about today, plus asking you, what's the best address to send those to. The sooner we hear from you in terms of that's the correct address, the faster we'll get them out. Our intention is to have everybody's correct address by the end of this week and getting them out, because I know you have one foot out the door from school at this point, like most of your students. Does that answer your question? Is that good?
Yes.
Okay.
And we have a couple of questions about seeing examples of SERP, but I think Courtney just answered that. There are SERP templates on the Project Adam website.
Yep.
And she is also happy to review any.
Absolutely. Yeah. You've got really 2 resources in Project Adam and Courtney and us. So however we can help you and serve you, that's what we're about.
I think that's all the questions for now.
Okay.
We're right on time.
Okay, perfect. Well, thank you all for joining us as well. We really appreciate your attention, and the chats were proactive and productive, I think, too, at the same time. And it really shows me that there are some gaps that need to be filled, and people like Global Medical Response are willing to help you, as well as the AHA and Adams Project. So thank you for joining us. Casey, back to you.